Today I'm talking about melasma, a very common problem and one that causes a tremendous amount of upset and general unhappiness, really. Patients come in talking about how someone comes up to their face and go, "Oh, you've got a little something on your lip." "Oh, no." And then they realise actually it's a brown smudge of melasma. So that kind of thing is quite common. So it makes women embarrassed about being barefaced, and it can make the summer a major problem. In fact, I have patients who really have stopped going on holiday since they developed the problem. So what causes it? Well, it's a combination of generally being female, only 10% of sufferers are men, being genetically predisposed. This is definitely a condition that affects those who tan easily, so Mediterranean skin types and darker. And it often is associated with being in strong UV light. So a common scenario will be a woman who's pregnant, who's on holiday, and boom, the pigmentation pops up. And it can typically affect the central part of the face in map-like areas of pigmentation on the forehead, cheekbones, top lip, and along the jawline. So it can be any one of those or all of those combined. Certainly the pigmentation in the central parts of the face, on the top lip, and the cheekbone and the forehead really do cause a lot of concern. And it can be difficult to conceal because it can be brown, grey or bluish tone depending on where the pigment is in the skin. So the best way to think about what we can treat a problem with is to think about how it comes about in the first place. So what is it that makes melasma happen? Ultimately, when our skin is exposed to sunlight, and the interesting thing is it's not just UV light, it's also infrared and visible light that trigger this reaction in the skin. What happens is the skin cells sound the alarm and tell the pigment cells, the melanocyte, to produce more melanin, which is then passed from the melanocytes into the skin cells, the keratinocytes, to form a kind of umbrella over the DNA to protect the skin cells from further UV damage. Now, when you think about that, what that means is we can block the pathway at a number of points. We can stop this signal from happening in the first place by blocking the generation of free radicals that occur on exposure to light. We can reduce the amount of melanin that is synthesized in the skin, usually by blocking an enzyme called tyrosinase. We can reduce the transfer from the pigment cells to the skin cells, and then we can exfoliate away the skin cells that already contain too much pigment. Now, all of this is influenced by our hormonal state. So whilst I mentioned that pregnancy is a common trigger, taking the contraceptive pill is also a common trigger. The good news is that those who are pregnant, many of those who develop melasma during pregnancy, it will disappear once they've had their babies. And certainly if the pill has been a trigger for getting melasma, it is worth stopping it. Now, one of the fundamental things about treating melasma is that it's best to treat it early. Less severe melasma is easier to treat than persistent, more severe disease. So that's why I think what you do to treat it is really important. So let's think about our options. Now, in my clinical practice, I have access to potent ingredients on prescription. And generally speaking, by the time someone has come to me, they are by definition selected for someone who needs those kind of interventions. So I'm not going to dwell on that too much today. That's certainly something I can answer questions on down below at a later point in time. But the systems I rely on in that context are Obagi New Derm's prescription grade system and also triple combination products, typically Triluma, Pigmenorm, are the ones that I use in clinic. But in terms of options for women to try over the counter, I think the best combination is to use ingredients at different points in the pathway in concert together to get the best possible results in combination with management of sun behavior. So looking at products individually first, as you might expect, a retinoid is the mainstay of treatment of melasma outside of the context of pregnancy. Retinoids need to be used at night. So that makes life quite simple, really. So I like a number of different products. One of them is the Redermic R from Roche Posay, which is gentle, yet effective and quite well tolerated. I also like products from Medicate, their retinol series, and Avene. Now, in terms of products for daytime, as I said, a combination product tends to work best. The combination of an antioxidant with something that reduces melanin production and at the same time encourages its elimination from the skin will work best. Now, this is a very interesting product from Bioderma called White Objective Lightening Serum. And actually it comes with some vitamin C powder that you actually decant directly into the product. Basically ensuring you're getting as fresh and active as possible a form of vitamin C. So that's quite a novel way to get the most out of your active ingredients. So it also contains niacinamide, glycolic acid and licorice extract. So acting at multiple points in the pigmentation pathway, and a great product to consider. Another one that I really like is one called Dual Advantage Cream from Therapeutics. I've mentioned this in context of my acne videos before, but the thing is that the active ingredients that really work are often very versatile. So this one contains 10% azelaic acid. Now what that is a very effective alternative to hydroquinone at blocking the effect of tyrosinase. And it's also combined with niacinamide, which reduces the way the pigment is passed from the pigment cells into the skin cells. It tends to be well tolerated as well, and it has to be said that sometimes that is a barrier to treatment. If someone has melasma in a delicate part of the face, for example the top lip, the skin there is quite thin, irritation can be a bit of a rate limiting step. So it's good to have a gentle but effective option to consider for those sorts of areas. I tend to always think of vitamin C as part of a treatment against problems relating to hyperpigmentation. Again, my go-to product is Obagi Vitamin C Serum. Anyone who suffers from melasma will also have anti-aging needs, and this is a well-tolerated kind of all-rounder active ingredient. So there has to be really a good reason to not have that in your skincare regime. And the good news is it's also safe in pregnancy. So those are a good range of products to try. If after a 3-month treatment period they seem not to be helping as much as you would like, provided you're following good sun protection and behavior modification, then it is worth considering seeing a dermatologist because they will have access to more potent products. Now, on the subject of sun behavior management, I think that is almost as important as the active agents that you use to treat your melasma. You really have to understand the role that UV and indeed visible light plays in driving this condition. So my go-to, as always, is physical sunscreen, and I think it's really important that you pay as much attention to which one you use as to how you use it. The one I've talked about today is the one from Epion's Ultra Shield Lotion SPF 50. The reason being it's highly water resistant, and I think that's so important. When you get hot and a bit sweaty during summer, the commonest place for women's sunscreen to rub off is usually by the hairline, or indeed they've just missed it in the first place. So I think a product that really stays put is important. The other thing I talk to patients about is ensuring they apply enough. It's amazing to me how many women will chronically under-apply sunscreen. And in fact, I've done a video on this, so please refer to that. But really, the average person applies about a quarter of the quantity required to deliver the level of protection on the tube. So really focus on that. And if you're in doubt, apply sunscreen in 2 thin layers. That way you're less likely to miss bits, and you will end up veering towards using the correct quantity that's actually needed to give you the level of protection on the tube. And then be sure to reapply it. Remember that you're exposed in the car and that UV light travels through glass, so I don't think that being indoors for most of the day is a reason to not apply your sunscreen. So just get into the habit of doing it every single day, and if you're consciously outdoors, please do reapply. Remember a proper hat with a proper brim, and the brim should be at least 7 centimeters in diameter. So measure it if you're in doubt, and it should be a dense material that doesn't transmit light. As a final note, I think it's worth mentioning that melasma is often triggered by beauty behaviors that are perhaps aggressive is the wrong word, but they're physical. Certainly on the show I present for Discovery, one of the commonest reasons for people coming in with pigmentation problems is a treatment that's gone wrong because it's been delivered with too much force, or perhaps was inappropriate in the first place. So be very cautious of treatments like microdermabrasion and light-based treatments. A common situation is someone goes and has either IPL or laser hair removal on their top lip, and all of a sudden they get a brown moustache. And it's a consequence of the melasma being triggered by energy entering the skin and tickling up activity in the melanocytes. So be careful about that sort of thing. I think it is worth considering what you eat if you're prone to melasma. This is a chronic relapsing and remitting condition, and once it develops, it may well be with you for as long as 11 years, according to one study. So I think it is important to maintain lifestyle measures that help prevent recurrence. So look out for foodstuffs that are rich in antioxidants, and if it's a really big problem for you, consider a supplement. Heliocare does a supplement called Ultra that's rich in a fern extract called Polypodium leucotomus, and there's a new drink from the US called UVO which is also rich in Polypodium leucotomus. So I think those are worth sourcing if melasma is causing you a lot of worry. I hope that was helpful, and I look forward to seeing you next time.